Dr. Susan Phillip from Pullareddy Institute of Pharmacy, and I'm studying my PharmD 5th year. I'm here to talk on the topic kill cancer. There is not a reason of doubt that we appreciate our health the most whenever we are sick, whether it be a small flu, cold or cough, or it could be a deadly disease. And when we hear the word cancer, the amount of fear that it instills in people is justified because of the length and the extent to which this disease has the potential to damage and affect lives, not just the subject, but also their caregivers. Cancer, as we know, is the disease that is caused because of the uncontrolled division of abnormal cells that arises because of the patient's genetic link-up interaction with carcinogens, whether it is physical, such as IV, UV or IR rays, or biological, bacteria, viruses, or tobacco, smoking chemicals, or it could be passed on as a hereditary disease. Whether or not we know the reason as to why cancer has been in a patient, one thing is for sure that we are all aware of the extent to which how deadly this disease can be. There was a time when we thought that cancer is just limited to the Western countries, but now India is not far behind. In fact, Indian Council of Medical Research reported that there is a 12% expectancy of new rise in cancer cases in the upcoming 5 years. Can you imagine that there was once a time that cancer was considered as an old age disease, but now it is quite common concern among the youth, women, men, anybody. Now, what are the challenges that comes along with cancer? One, of course, the physical changes in the patient, extreme weight loss, strict diet, and frequent attacks of any small infection. But the excruciating amount of pain on the person as well as their friends and relatives, there is no match for that. Now, when we talk about mental health, it is often deteriorated. Anxiety, depression is always common, and it could be neglected as well. The fear of the money that is going to be invested because of the long-term health care, that has to be the amount of money that is going to be put in, that instills so much of fear in the patient and their caregivers. The stigma that is associated in the society. For example, breast cancer is not just common in India, but worldwide. Now, once cancer is diagnosed, there are other challenges. For example, new effective complete cure of late-stage cancer, pancreatic cancer, glioblastoma, to name a few, multiple regimen therapies, the complexities that arises with it and other complications because of that, reoccurrence of cancer because of non-elimination of the cancerous cells. These are some of the big major challenges, and if we have to name them one by one, we can enlist so many. So it is no less than a tug of war between protecting the normal cells as well as killing the cancerous ones. Now, what is the solution to this? There is no one-way solution. It has to be an integrated plan. One, as the role of the subject or the patient. Early detection is always the best way to completely kill cancer. People who have a familial history with cancer should especially go for routine health checkups. Second, to be free to express their concerns with the clinician. Second is the role of the clinician. There is an old Chinese saying that says, I hear and I forget. I see and I remember. I do and I understand. It is important that skills and knowledge is there, of course, but along with that, experience is very important. The role of us as pharmacists. It is important that we tailor the treatment according to the patient's requirement and needs. Procurement is one major concern. During procurement, some of the major challenges include delay in manufacturing and the most demanded drugs such as fluorouracil, doxorubicin, which has major shortages. So in order to curb that, many people have to go to alternate institutions or alternate medication plans, because of which the healthcare outcome is limited. Next, in terms of transcribing and prescribing the process, it has to be, especially special care has to be taken in geriatric and pediatric patients, women as well. Now, medication errors are much on the rise. For example, there are 10% oral medication errors in leukoblastic lymphoma patients in pediatrics. So, an integrated plan is important where the subject, the caregiver, as well as the pharmacist with the clinician has to work together. Lastly, counseling the patient the onus is on the pharmacist to counsel the patient accordingly, and especially when they hear something shocking all of a sudden. Dealing with sensitivity is important on the pharmacist. Lastly, us as responsible citizens. I'm sure that we all are aware of the WhatsApp University the fake information, misinformation that is often spread in our community. It is important that when we know something of that length can be circulated, we need to educate and help our relatives and friends to stop that link right there. Social media is a very important platform, but we need to use it wisely. Advertisements that promote the use of tobacco smoking has to be curbed, and especially in our state where neck cancer, mouth cancers are much on the rise, especially in the rural areas. The government has to include better health welfare schemes where good healthcare schemes are introduced not just for the poor, not just for the rich who have good access to it, but for everybody. All sections of the society need to have the access to affordable, quality healthcare. Lastly, to killing not just the physical cancer, but also cancer of the mind, where stigma and taboo associated in the society has to be killed. Healthcare that has to be accessible to everybody. Only then can we completely kill cancer. As in conclusion, what I'd like to say is that in order to kill cancer, there is no one-way approach. It has to be an integrated plan. Because as an individual, so little can be achieved. But together, so much can be achieved.